Hello everyone. In this video, we are going to see about what is meant by OTC medications. In this video, we are going to see what are the introduction definitions, role of pharmacist in dispensing the OTC medications, and what are the OTC medications were available in India, and then a role of the pharmacist in patient counseling about OTC medications. First is introduction. In introduction, mostly majority people treat their ailments through OTC medications only. In India, mostly majority of the people will treat their diseases like headache or fever, common colds through OTC medications only. Self-medication means is a selection and use of the medication by individual to treat their self-recognized minor ailment or symptoms. Self-medications is an age-old practice all over the world. According to World Health Organization, it promotes the practice of the self-medication for effective and good relief of symptoms where medical services are inaccessible in rural and remote areas. Mostly in rural and remote areas, there will be the medical services will be less, so that we can OTC medications we can easily quickly and quickly it will relieve the symptoms. So they promote the OTC medications. Self-medications with OTC medicine sometimes is referred to as an responsible use of the medicine. Self-medication is widely practiced in both developed and non-developed countries, developing countries also. OTC medicines may be approved by safe approved as being safe for self-medication by the National Drug Regulatory Authority for the prevention or treatment of the minor ailments such as common cold, diarrhea, period pain, or symptoms which do not require immediate medical consultation. In these conditions and all, we can use OTC medications. Then definition. What is meant by OTC? OTC medications is defined as the medicine or pharmaceutical product or drug which is considered to be a safe and effective in controlling the symptoms of the minor ailments, not major, only for the minor ailments, and can be sold by the pharmacist itself in the pharmacy without any valid prescription. We can easily sell or we can easily purchase the medicine which will be available in the pharmacy without any valid prescription. In some countries, medicines are categorized into prescription medicines. Mostly medicines will be categorized as prescription medicines, which medications which are given only by the prescription. Valid, if we have valid prescription, then we will get a proper medication. The second one is medicine. The pharmacist can dispense based on the minor ailments. If any patient says any symptoms like they have throat pain and light stomach burning sensation, then for this condition and that, pharmacist can prescribe or dispense the medicine. Is the second type. Third type is OTC medication, which can be easily available in pharmacy, groceries, etc. In which the patient itself can ask for this medication. Advantages of having OTC medicines. There are some of the advantages for OTC medications. Mostly OTC medications will be safe medicines and effective. Both safe and effective medicines are considered as OTC medication. So this is one of the advantage. Then it does not need any medical consultation, like any charges from the prescriber. No need to wait, no need to uh, give charges for the prescriber. We itself can ask for the medicine in the pharmacy. This is second advantage. Third one is the cost of the medicine will be economical. Then fourth one will be the consultation time will be saved. Then fifth one, the pharmacist can also prescribe the OTC medicine without any prescription. These are the five major advantages of using the OTC medication. First one will be it will be safe and effective. Then second will be there is no consultation charges. Third will be economical, that medicine will be cost will be low. And fourth one is waiting time will be saved. Then fifth one, pharmacists can also easily dispense the medication. Then next topic is what are the OTC medications that commonly used in India? H2 receptor antagonist. H2 receptor antagonist means mostly these drugs are used for the acid reflux, like peptic ulcer, GRD. In this condition, only burning sensation if the patient have digestive problems, acid reflux. In this conditions, they can easily purchase the medicine without any consultation from the prescriber. Easily they can purchase the medicine in the pharmacy. This drugs may be used to lower the doses to relieve heartburn, acid ingestion, indigestion, and so stomach. This product should not be used for we should not use this product for more than 2 weeks. If more than 2 weeks the patient condition is not subside, means the patient has to consult the prescriber, then only we can dispense the medicine. For up to 2 weeks we can dispense the medicine without we can dispense the medicine without any proper prescriptions. Then not mostly this acid reflux medications are all was not approved for the children's. This is mostly for an adult age group peoples only. Example, cimetidine 200 mg BD. This drug is can be given without a prescription. Famotidine 10 to 20 mg, ranitidine. These are some of the drugs which can be dispensed without any valid prescription. Next one is analgesics and antipyretics. Analgesics means painkiller. Antipyretics means which was used to reduce temperature. These drugs may be used in lower doses to relieve Okay, second type will be antacids. This are combination is less likely to cause constipations or diarrhea and offer high neutralizing capacity. Antacids mostly can be dispensed without any valid prescription. Example, magnesium hydroxide, aluminum hydroxide. This combination drugs which can be prescribed without any valid prescription. Then we can also dispense analgesics, antipyretics. Some of the analgesics like aspirin and all we can dispense, and antipyretics like paracetamol. Acetaminophen. These drugs can be dispensed without any proper valid prescription. Then anthelmintics. Anthelmintics means disinfectants, like which are used to do to control the prevent reinfection, like that. Example, pyrantel pamoate 11 mg per kg can be prescribed without can be dispensed without any proper valid prescription. Next one is antidiarrheal agents. Mostly in India, the people having diarrhea starting stage will not go to prescriber. They will mostly get the medications from the pharmacy only. So antidiarrheal agents, some common antidiarrheal agents also used as a can be dispensed as a without any valid prescription. This drug stand often to black salicylates are observed and can cause tinnitus. Example, bismuth subsalate 600 mg 4 times per day can be used to low pyramide 4 mg initially, then 2 mg after each loose tools. Maximum 16 mg per day can be used without proper prescription. These are synthetic opiates which does not penetrate the central nervous system. Mostly antidiarrheal agents also used without any proper prescription in India. Then next one is antifungal topical agents. Mostly fungal infections means if there is any skin changes, means the people in India mostly they won't consult the doctor, skin doctor for medications. They will mostly prefer the pharmacy only. So some of the antifungal topical agents also used without any proper prescription. Example, cotrimazole 1% cream or 100 mg vaginal insects. Tolnaftate uses 1% solution cream or powder. Bisonazole nitrate 2% cream or 100 mg vaginal tablets. Fungicides are these are the drugs. These are the topical agents which can be used without proper prescription. Fungicides are successfully effective for the treatment of tinnitus, tinnitus, and tinocorporeous. Clotrimazole, meclizole are also effective against Candida albicans. For this of infections, we can topical infection, we can use this medications, topical agents without any proper prescription. But also if the infection is not controlled, or the patient is having any bacterial infection inside, means the patient is if the patient is having any fever, along with that if the patient have a skin fungal infection, means he or she should consult the doctor only. If he can use the topical agents from pharmacy. If it does not cure, means he has to consult the doctor. If the patient has a diabetic and if the skin infection is not controlled, means she should consult the doctor without continuing the topical agents. He should consult the doctor and take proper treatments. And then anti-inflammatory topical agents. Inflammatory hydrocortisone 0.5%, hydrocortisone used as a 1% cream or spray. These are used as topical agents which can be given without prescription. These are used for the temporary itching, inflammation. If there is any minor inflammations inside bites, For this conditions and all, we can use this topical inflammatory and anti-inflammatory agents. This can be applied in small amounts, 3 to 4 times daily. You can use this anti-inflammatory agents only if the patient has minor inflammations, means we can use it. Where the inflammation was high, major means we should consult the prescriber. Next one, anti-seborrheal agents, selenium sulfide, 1 to 2 percentage, zinc pyrithione 1 to 2 percentage. These are used as for scalp cleaning, for any anti-fungal, for fungal scalp. For these conditions and all, we can use this scalp shampoos or cream. We should apply that in the scalp and for 5 to 10 minutes, and then wash it. We can use this 2 to 3 times weekly until the scalp becomes clean. Selenium sulfate may be cause irritations to the eyes or skin. If any irritation caused in eyes or skin, means we should stop the medication. Then we can consult the doctor, and based on our skin type, he will suggest the medicine. Then we can take that medication. Don't continue this medication if there is any irritation. Then antitussives. Antitussives means example codeine 10 to 20 mg we can use 4 to 6 hours. Dextromethorphan, these are the agents. Dextromethorphan 10 to 20 mg per 4 hours or 30 mg per 6 hours. With guaifenesin, this both drug with guaifenesin, we can use this antitussives can be given without any proper prescription, but we should use this medication with cautions only. If there will be most of the addiction can be caused by using codeine and all, so we should not continually dispense this medication. Pharmacist should not continually dispense this medication, or she should not give medications for a whole week and all. We can use 2 or 3 medication. If this problem is not cured, means he should consult the doctor and take the proper prescribed medications only. Next one is decongestants. Decongestants, example oxymetazoline topical, xylometazoline topical, phenylephrine topical, pseudoephedrine 60 mg per 4 hours oral or 120 mg per 12 hours oral. Phenylpropanolamide 25 mg per 4 hours oral. These medications are used as decongestants. Decongestants means for lung congestion and all. Mostly people will not consult the doctor. They will get into the pharmacy, and based on their condition, they will ask the medications only. But if the patient has COPD or other allergic conditions, means he should definitely consult the doctor and only take the proper medication. If the patient adult age group only, or adult age group, it is based on the cold condition, means he can take these medications from the pharmacy. For children's, it should not be given from the pharmacy. The proper prescription has to be taken. Then next one is expectorants. Expectorants example guaifenesin 20 mg per ml. This is also based on the guaifenesin 20 mg per ml. It is a single expectorant that has a scientific evidence of safety and efficacy. So that we can use this medication, expectorants, because it of its safety and effectiveness only. Then if the condition was not good, means he has to visit the pharmacy, visit the prescriber only. Laxatives, guaifenesin 20 mg per ml. It is a next one is smoking cessation aids. Example nicotine, pola, These are some of the agents which can use the smoking cessation aids. This can be given in the pharmacy itself without any proper prescription and all. This can be used for 6 weeks. Placebo quit rate will be 25% after 1 year of continuous usage. Review directions will be given in the package itself. The patients would the people should read the instructions carefully and take self titration and weaning are involved. Mostly smoking cessation. How to use smoking cessation means there will be an instruction which was separately given. For as a pharmacist, we should consult patients about. We should suggest how to use the proper method. We have to inform the patient. We should the gum should be chewed continuously until the taste came. If any taste was persistent, means keep them gum between the cheeks, and then after the taste was went, we should use them. Then also continuously chew the gum. You in this order only he should use the smoking cessation gums, and we should pharmacists should properly advise the patients about the proper usage of this smoking cessation aids and all. Then after giving proper instruction, it can be dispensed without any prescription aids. Then we should also say about the withdrawal symptoms. If continuously using this chewing gums and all, we will get some symptoms, withdrawal symptoms, if we stop this chewing gum and all. So how to properly stop the chewing gum, we should explain the patients about this. We should say then if the patient is chewing 3 or 4 chewing gums per day, means we should inform to reduce the count, first number of counts, like if a patient is using 4, means in next week you should reduce it to 2, then or 3, then to 2. Like this we should advise the patients about the proper usage of this chewing gum. After explaining the proper usage, we can dispense the chewing gums without any proper prescriptions. Then patient counseling. How to do patient counseling about the OTC medication. First one step one is every pharmacist, normal, like normal patient counseling, we should introduce ourselves, what is our name, and what are the provision in this patient counseling, what are the benefits you will get, like that. Then make them comfortable, relax, and ask them if there is if they have any time to continue this session. Then we can first of all we should start with a smile, we should mm, talk about normal conditions, normally, about their family, what is their work, like that. These are the normal conversation we should build, then make them friendly. Then we should explain about, we can start explaining about this OTC medications. First start with if the patient is using OTC medications means we should inform them about the proper selection of the OTC medication, and we should explain how to use the proper way, method of using the OTC medications, and in step 2, in order to clean from the pharmacy should first and foremost try to obtain relevant information about. We should in patient counseling the major is we should obtain their patient informations. Example, patient's age, the patient was, whether the patient was pregnant, saying weight, the patient's weight, allergics, what are the allergics have the patient have, if is patient have any smoking or alcoholism, social history, family history, we can gather informations, relevant informations, disease, patient disease conditions, example any present illness, past illness, whether the patient is taking medications for generic or brand name, we can say that name to the name, about the name of the drug. Then route, in which route we should take the medication, dosage form, tablet or injection, powder, like that, cream, dosage, which dose we should take the medication, and administration schedule, how to administer, when to administer, frequency. Then special instructions, what are the special instructions, what are the precautions to be taken, techniques for self monitoring of drug therapy, storage of these medications, potential, what are the potential drug interactions, drug food, or other any interactions, if whether happens due to OTC medications. If the patient take current medication with OTC medications means, what are the drug interactions will cause, drug food interactions, like that. Other therapeutic contraindications, whether this drug is contraindicated for pregnant pregnant for pregnant women, children, whether it is contraindicated, like this informations we can say. And Accordingly, other information peculiar to the specific patients or drug. Like this information, we can say. Then, role of the community pharmacist in dispensing the OTC medications. What are the role of the community pharmacist in dispensing the OTC medications? Pharmacist must have a greater responsibility in educating the patients regarding the safe use of the medications. In every counseling, and the pharmacist has a role in educating the patients about the safe use of these medications, and which monitor their health in terms of therapeutic outcome and improve quality of life. To improve their quality of life, we should suggest the proper and just safe usage of the medications. Often patient business pharmacists will encourage about the management of minor ailments such as headaches, sore throat, stuffy nose and cough, diarrhea, periods pain. For this only, they will visit the pharmacy without visiting the prescriber. So, this condition, as a pharmacist, we should counsel the patient about the proper and safe usage of the OTC medication. If after taking the OTC medication also the patient is not cured, means he should consult the prescriber without consulting the other pharmacists. Um, we should tell the patients about for which all the condition they can take OTC medication and which are the conditions they should not take OTC medications. And if the condition is not cured for 1 or 2 weeks, means she should consult the prescriber. We should inform about this to the patient. Then, whenever the pharmacist dispenses the medicine, counseling about the non-prescription medicine is very essential due to their potential interaction with the disease process or with the other prescription medicine. Yes. Whenever the pharmacist dispenses the medications, mean we should counsel the patients about about taking non-prescription medications. If we are giving the dispensing the medicines, means we know these are the medications will interact with the OTC medications will interact with this current medication, so we should not give the medication. But without if they give this prescription and bought the medicine from our pharmacy, and he will take non-prescribing medication from other pharmacy, means we don't know, right? So we should properly inform the patient about what are the non-medication should be avoided while taking this drug, and why it should be avoided, what are the potential interaction will take place while taking this current medications. With some medications will reduce the effect of the current medication. Some medication will increase and cause adverse events, toxicity, and so we should properly inform the patient about this. Then the pharmacist should ask the patient about the clinical condition for which the OTC medicine is required. Also about the other prescription medicines the patient is taking. Yes. For what condition the OTC medicine has the patient is asking for. Like if the minor ailments like headache, cold or diarrhea means we can give but we should also ask them about if the patient is currently taking any other current medications. We can check it if there is no interaction while taking this medication mean we can we can dispense this or these medicines. Then finally, for example, if a patient is suffering from stuffy nose and want a remedy for the clinical conditions, and the patient is hypertensive and taking antihypertensive medicine, it is essential to avoid giving anti-cold preparation contain phenylpropylen, as this drug may elevate the blood pressure. Yes. um, if normally the patient is suffering from stuffy nose, stuffy nose, he has cold so he need a cold medicine. He was asking in a pharmacy. We can dispense the cold medicine. It is normal in India. We can dispense it as a autism medicine. But if the patient is antihypertensive, if the patient is taking antihypertensive medicine for hypertension means it we should avoid phenylpropylen preparations like preparation anti-cold preparation, because that ingredient containing medicine will elevate the BP of the patient. So if we asked only, we will come to know the patient was currently taking this medication. For patient was having this condition, currently the patient having this condition, so we should properly ask the patient about this answer. Then only we can properly suggest about the medications, and we can safely give the medication. Safe and effectiveness is more important than everything, so that in for medicine only the safetyness is more important because it is related to life. So we should say properly search about the we properly analyze about every condition of the patient before dispensing any of the drug. Some for some other some drugs will contain alcoholic preparations also. It should also avoided in some conditions. um, like that. Antacids, we can give antacids as OTC medication, but it is for current medication. If the patient is taking any other drug, some mostly more drugs will inhibited by most drugs absorption will be inhibited by the antacids. So we should properly analyze what are the medicines the patient is taking, and then only the patient should be given with OTC medication. For example, in other conditions like paracetamol also, it is given as OTC medication, but long term usage or long drug usage of paracetamol can cause hepatic diseases, hepatic failure, like these conditions. So, paracetamol is a normal medicine which was usually taken by everyone for fever, cold, and a painkiller. As a painkiller, also mostly more people will take paracetamol, but it has also have a major side effects like this. So we should inform the patient will be unaware of these conditions and all. So if we properly inform the patient about this and all means they will also come to know about the side effects of taking autism medications. uh, they will not normally they will not know about what are the drawbacks they will face taking this normally, avoiding charges in a with the prescriber and waiting time. For to save this, they will normally take the medication from the pharmacy. But there is also a drawback behind this. So if we inform this to the patient, they will also understand and they will come to know, right? So you should properly inform the patient. Similarly, if patient is using ciprofloxacin like this, ciprofloxacin is an antibiotic. If the patient is taking ciprofloxacin and asks for an antacid for resuscitate, pharmacists know about the use of ciprofloxacin. Pharmacists may advise the patient to give. Oh yes, normally ciprofloxacin is an antibiotic used for antibacterial conditions and if the patient is taking ciprofloxacin, the patient is also asking for an antacid for what acid reflux. So the pharmacist should ask whether he was taking any other medication. Then he came to know the patient was taking ciprofloxacin. Then we can suggest, right? Because ciprofloxacin absorption is inhibited by the antacid. So we can say there must be a proper gap between 2 hours or 3 hours gap should be maintained between the medications. Between two medication we should maintain the proper gap. 2 hours gap should be maintained because ciprofloxacin absorption will be inhibited by the antacid. If we say if we explain this properly to the patient, means they will understand and they will take it properly. If we do not explain this to the patient, they will take this medications, both the medication in the same time, and there will be no effect of the ciprofloxacin. For this condition, we can also give other instead of antacids, we can give pantoprazole, other acid reflux drugs, so that subsumption will not be affected, right? Like this, for this only we should ask the current medication profile of the patient. Okay, in this video what are we learned is first what is meant by Otc medications, we learned about it, and then what we learned is what is the main definition of autism medications, then what are the advantages of taking autism medications, what are the disadvantages, then what are the autism medications popularly used in India. That's all. Then what we learned is about the patient's counseling. Counseling about dispensing the proper medications in the pharmacy. What are the patient counseling has to be given while taking prescribing, while dispensing the autism medications. And thank you.